So our last speaker is Jane Soothill. So I'll ask you now to join to turn your video on. And Jane is the Communities and Prevention Officer at Surrey County Council, and Jane is from one of these test and learn sites essentially, and is going to be giving a view on how you're going to embed a strategy really for green prescribing within a particular area. So I would love you to tell us a bit more about how you're planning on integrating green prescribing with the within the healthcare system in Surrey area.
Thank you. Yeah, so Surry Heartlands is one of the 7 national test and learn sites that Sam just outlined, and we are working as a partnership between health, which includes the CCG, hospital trusts, primary care, and community health providers, the local authority, Surrey County Council, our district and borough councils, and also our VCSE sector as well. And so we're working as this partnership to really develop a vision of what we want to achieve and how we want our social prescribing services and our health pathways to be different as a result of this 2-year pilot. And so the steering group, for example, that oversees all of this work is a partnership between Surrey County Council, Surry Heartlands CCG, and also our environment sector as well. So, which in fact, I think I'm right in saying that within Surrey Heartlands, I don't think those 3 groups have really come together in quite that way before to work together, not with the green environment sector involved.
So a new partnership, yeah.
Yeah, very much so.
That's really great. And yeah, how is it working so far with all those very different groups coming together, or not coming together, as the case may be?
No, they are coming together. This is what's interesting about it, actually, is this real swell of enthusiasm that's around for green social prescribing. I mean, when we were preparing to write the bid, as with all these things, there's always very tight deadlines, and we organised 2 sort of engagement workshops in preparation for this, so that we could co-produce our bid. And we had over 90 participants at each workshop. They'd only had a few days' notice, so there's a huge enthusiasm for this. And now that obviously we're further down the line, and we are one of the test and learn sites, we have established a green health and wellbeing network, which is part of our sustainability plans. We intend for that network to continue beyond the life of the 2 years test and learn. And we have over 140, 150 members of that green
already. Yeah, it's early.
And we've got the way that we've set up our particular project is to have 7 working groups which will oversee different aspects of the project, such as community engagement, sustainability, evaluation, training, that kind of thing. And each of those working groups are co-chaired by people from different sectors. So we've got somebody from health and social care working in partnership with somebody from the green sector, or perhaps one of our leisure sectors as well. So so this is just for us, this is quite a new way of doing things, and each of those working groups again has a membership of sort of 40 plus partners who are happy to really sort of give up their time to come and work on this project. So a lot of enthusiasm for this.
So quite a unifying vision, really. The sort of the green prescribing sort of element.
Absolutely, I think it's interesting actually, because I think social prescribing, which is fantastic, and that's my day job, is to integrate social prescribing into our local health and social care system. But social prescribing, you have to explain, you have to give people time to understand about its role in addressing health inequalities and the wider determinants of health, and it's been quite a sort of slow burn. There's something about green social prescribing, green and blue social prescribing, that people just understand, which perhaps it's the appeal of nature, and perhaps it's the effects of COVID as well, as people have already commented that we've all understood perhaps the benefits of nature, and nature's helped everybody to sort of get through the last few months that have been so hard for people.
That's interesting. I mean, I certainly found it's in the health setting. I find when I work in hospitals that people tend to bring people together, the sustainability vision. So it's interesting that you've seen that as well in the community. So just very quickly, I just was wondering, obviously you're part of a group of test and learn sites, and I just wondered what benefits you see as being part of that group, because I know, for example, that you have workshops sometimes to come together and learn from one another. And
yeah, that's right. Yeah, I think it's always helpful when you're working in a new area to be able to come and share your experiences, share your questions and your learning with other people who are doing similar things. And that's the same across social prescribing, whether it's establishing your strategies and your vision there, or whether it's the green social prescribing, because every test and learn site is taking a slightly different approach. And it's always really useful to come and together. We've had one sort of group workshop where we've all been able to meet each other and in exchange sort of questions and exchange experiences and things about what we're planning to do and how we're planning to go about doing that. And I think it isn't necessarily what you're planning to do, it's more of a how are you going to achieve it that you need sort of some support with sometimes, and some
overcoming those barriers and those sort of difficult dilemmas.
Exactly. And we've also got space now on the NHS England collaboration platform as well. The green social prescribing section there's a sort of more open section, then there's a section that's just for the test and learn sites to be able to share information together as well. So lots of support there around how these test and learn sites can really make the most of the 2 years that they have to put some of these ideas into action.